Thank you, Mr. Speaker. In February, the Minister of Health told the good people of Beaverlodge that the money for planning a new health facility had already been allocated and the design for a new healthcare facility would be moving ahead. Since the Minister of Health has stated, when I make a commitment, you can count on it, and given that the good people of Beaverlodge are counting on the Minister to uphold her commitment to planning this facility, to the Minister of Health, can you confirm that you are currently planning the Beaverlodge Health Facility?
Good question.
Honourable Minister.
Thank you very much, Mr. Speaker, and to the member for his important question. Absolutely, the residents of Beaverlodge have worked hard, and they've advocated long for the community and the healthcare needs to be met over many years. I have the pleasure of meeting with Doris McFarlane at that exact moment, Mr. Speaker, and she, having formerly been a nurse and also being somebody who wants to ensure the community has long-term positive outlook moving forward, has graciously offered a significant portion of land, and we are happy, Mr. Speaker, to ensure that we are moving forward with plans to ensure that Beaverlodge does get a new facility at some point, Mr. Speaker.
First supplemental.
Thank you, Minister. And given that $2.5 million allocated for rural health facilities design template appeared in the Minister of Infrastructure's 2016 budget, and given that the 2015 budget allocated those funds to create a model that could be used on healthcare facilities in rural communities across the province, including Beaverlodge, to the same minister, is the $2.5 million you referred to in the Ministry of Health's budget, or is it in the Ministry of Infrastructure budget?
Honourable Minister.
Thank you again for the very fair question. The member is right to say that that is what I said. The 2.5 is indeed in the Minister of Infrastructure's budget. In the budget previous to that, which was passed only about 6 months before, I believe, we also had a line item, I believe it was $10 million for rural facility and needs assessments to be done throughout the province, Mr. Speaker. So both health and infrastructure have been making sure that they have resources available, and my staff have a number of projects on their plates, but this continues to be one of them, Mr. Speaker.
Thank you, Minister, for that clarification. Given that the Ministry of Infrastructure has money in their budget to design rural healthcare facilities such as Beaverlodge for 3 years now, and given that in estimates I asked the Minister of Infrastructure if something was actually going to get done this year, and given that the Minister answered that they were awaiting direction from the Ministry of Health, to the Minister of Infrastructure, are you still waiting for the Minister of Health to direct you to design rural health facilities such as Beaverlodge?
The Honourable Minister.
Thank you very much, Mr. Speaker, and thank you very much for the question from the former infrastructure minister of the previous government. And the rural health facility design project is indeed the Alberta infrastructure budget. Excuse me, Mr. Speaker. Approximately $2.4 million has been allocated this year for the work. We're nearing the completion of this initiative. It will standardize documents and processes and provide consistent information for the planning and development of future rural health facilities. Various facilities are included in the project, including—
Thank you, Honourable Minister.